हाय एवरीवन। मैं हूँ डॉक्टर पायल शर्मा कामत। मैं एक साइकेट्रिस्ट हूँ। आई वर्क एट आस्क यूरो केयर एंड माइंड क्लिनिक विच इज़ देयर इन बोरीवली. See, in our daily routine, washing our clothes, washing our utensils, or before you leave your home, you check your door, checking if your gas is off or not, checking if all doorknobs and tabs are properly closed or not, you know, washing your hands while before you eat, after you come out of the washroom. Like it's quite normal, right? But what if a person that you know start washing their hands 2 times or 4 times or 8 times or 50 times, and they can't get satisfied? They feel that, my hand is again dirty, and then they continuously wash it for 100 times once they go into the washroom. Tell me if it is normal. See, this is a part of a disorder, which in our medical language we call as obsessive compulsive disorder. So let's discuss what exactly is obsession. Obsession is any unwanted, unnecessary, intrusive, repetitive thought which you know that it is unnecessary and you want to get rid of that thought. But no matter how much you try, you're unable to. And this obsessive thought can be of various types. And whenever you have this obsessive thought, it leads to a significant amount of anxiety, a significant amount of restlessness, discomfort. You just want this thought to go away from your mind. You know it's not right. How you can make this go away? You find reasons in your mind for actions and behavior, some kind of thought process which will make this obsession go away, which will make this anxiety, this restlessness, this discomfort go away. So, a person who has obsessive thoughts can get into a trap of compulsive action. What exactly is a compulsion? It's a behavior which reduces this compulsive thoughts. Let's, for an example, you have a thought, that obsessive thought of germs. So, to neutralize the thought of germs, you'll try and washing your hands or washing your clothes. The second example, you have an obsessive thought of being unsafe or something is going to go wrong. So you double check. You have a compulsion of checking. Similarly, and compulsion of arranging things. You keep everything in order, you keep it, from the smallest to the tallest, arranging according to the numbers. This obsession is always associated with anxiety that something bad will happen. If I don't arrange that, there can be something bad will happen. Or there is an obsession or a ritual of a ritualistic behavior, you know, repeating something, counting, uh, thoughts of, good thoughts keeping in your mind, constantly thinking about good thoughts, which are associated with obsession of bad thoughts or associated with any kind of sexual or aggressive thoughts. So this is an obsession, this is a compulsion. So there's always, to diagnose a patient with OCD, we need either an obsession or a compulsion or sometimes both. So this is how we recognize a patient with obsessive compulsive disorder. When you look at their cases, we generally wish to find what can be the major cause of OCD to happen. It is generally a genetic and environmental causes that we see. A lot of time it is the cause is unknown in a lot of cases, but biochemically there are serotonin neurotransmitter where there's imbalance and dysregulation leads to these kind of obsessive compulsive disorder symptoms. The causes can be genetic, can be environmental, can be brain related changes, neurochemical changes, and also stress related. So, who generally gets the symptoms of OCD? How common it is? According to the studies, it has shown there are 3% chances of having a lifetime prevalence of OCD. Men and women both are equally susceptible to the illness. There is no discrimination as compared to, as per the age, as per the living standards, and anybody and under the sun can develop the symptoms of OCD at any point of their life. What the treatment options do we have? So this obsessive compulsive disorder symptoms need to be thoroughly evaluated by a psychiatrist or a psychologist. These are The treatment options are psychotherapy and medication. There are very effective medications and counseling sessions which can really help a person to come out of OCD. With the help of medication and psychotherapy, you can come back to your daily routine, you can enjoy your life, you can come back to your routine of, socializing with people, be relaxed, comfortable, get rid of those anxiety. And kindly, if you see anyone having symptoms of OCD, if you feel that there are a lot of ritualistic behavior, a lot of anxiety that you can see in the patients, they are not able to, get back to the routine, take help, take them to the psychiatrist or a therapist, and it's completely treatable. Bye, guys.